Hi, everyone. We'll just give everyone a minute or two to hop on, and then we will go ahead and get started. Thank you so much for joining. Okay, well, we'll go ahead and get started just to be respectful of everyone's time. Welcome, everyone, and thank you for joining us today. My name is 𝗡𝗲𝗄𝗏, and I am going to be the MC of our talent talk today. I'm joined today by some of our amazing staff to discuss the nursing culture at Ochsner campuses across the regions and career opportunities available to those that would like to join these fantastic teams. But before we get started on that discussion, I'd like to take some time just to introduce our panelists so you can learn a little bit more about them and the work that they do, and then we will go ahead and dive into the discussion. So joining us today, we have 𝗟𝗲𝗄𝗏, Rachel, Gladys, and Katie. So first we have 𝗟𝗲𝗄𝗏 𝗥𝗡𝘀. She is the nursing director of the emergency department at Ochsner Medical Center Jeff Highway in New Orleans, and she has worked for Ochsner for 12 years. We have Rachel Smith, who is the Director of Acute Care Services of Ochsner University Hospital and Clinics in Lafayette, and she directs services for the med-surg tele units, ICU, and therapy departments. And Rachel has been an RN for 37 years and has served as a leader since 1999. And she's been with University Hospital for over 26 years. And then we also have with us Gladys Wolf. She is the Director of Hospital Operations for Ochsner Rush Health in Meridian, Mississippi. Gladys directs all inpatient units, including med-surg tele, ICU, and inpatient wound care. She also directs the cath lab, cardiac rehab, and outpatient wound care. So those are all of our nursing panelists joining us today. Now we also have with us today Katie Kraft. Katie is a senior student talent recruiter in our talent acquisition department, and she's going to be sharing with us everything you need to know about applying for a job and what to expect from the interview process, the timeline. So we're really excited to hear what Katie has to share with us. Now, I know this is going to be a very informative discussion, but should you have any questions throughout the presentation, we will be leaving time at the end of the presentation to answer any and all questions that you may have. I'll let you know when it's time for questions, and you can either ask them aloud or you can just put them in the chat, and we'll make sure to get those answered for you. So with that, let's go ahead and dive into the discussion. So first, I'm going to have Gladys kick us off. Gladys, can you provide us with an overview of your unit over at Ochsner Rush and why it's a great place to start your nursing career?
Well, I'm over the inpatient units, which includes medical, surgical, and tele units. There are 3 of those. There are 23 beds each. It's a good place to start as a new nurse or as a nurse graduate. You gain your strong foundational skills, such as critical thinking, your assessments, how to do basic skills. You learn all of those things that help with your time management, which will help you later on as you grow in your career. Our nurse to patient ratio is a 1 to 6, and we also schedule CNAs to help the care of those patients throughout the day and any shift. It's a great place to be. I really like how our teams come together and work together to care for those patients.
That's great to hear. Can you share, I know you said it's a great place to work. Can you share one of your most successful days on the unit?
I think every day it's successful, but there are those special days when I see the teams come together to provide that care for that one patient who is exceptionally ill, and they go above and beyond for that family, and they spend a lot of time with them. That's very successful for me, and it makes it a great day for the team.
Love that. And then how can you describe orientation for a new graduate at Rush on your unit? What would that look like?
Coming in, every new grad is placed into the residency program. They work with education throughout the time frame of the first year with the residency program. We also schedule a preceptor for each new nurse, and they're scheduled for 36 bedside shifts with the preceptor. We do make exceptions to that if you're on vacation, you're out ill, or need to go longer, or we do that for them.
That's great. Thank you for sharing, Gladys. I know Rush is, our newest hospital in the 𝗟𝗡𝗀 family, so it's great to learn about what you guys offer over there. So now I'm going to pivot to Rachel. Rachel, can you share your unit with us at University Hospital and Clinics and why it's a great place to start your nursing career there?
Sure. What I think makes us special is our academic setting. We actually have two med-tele units. One is a 14-bed unit. The other is a 28-bed unit. The complexity of the patients is pretty equivalent. All are beds that are cardiac monitored, and the patients are mostly medical with comorbidities that are related to our location. A lot of diabetes, COPD, renal disease, some behavioral health, some infectious disease, and then general surgery, bariatric surgery, some GYN and ENT. And all of those patients are cared for primarily by resident physicians, which means everyone is in that continual learning mode. And I think that adds to the depth that we get as nurses here. The ratios are 1:4, 1:5, and that's a function of how we're set up. Each unit is divided into 14-bed pods. So that makes the work as equal as possible within that pod, and the work is supported by CNAs and unit secretaries. We do have a blend of RN and LPN nurses, a mix of tenure. We have some nurses that have been here over 30 years. So I feel for a new nurse coming in, the support is there. And I think that's really important when you're right out of school and transitioning into practice. I've worked here, like I said, for over 26 years. And what has always impressed me is our ability to wrap people in. And because those that are tenured have such a sense of service to our community, it really makes a difference in how people respond when they start working here. We're a safety net hospital, which means the majority of our patients are not well resourced, and they depend on us for not only the medical aspect of their care, but also helping in that transition back home, because many have social challenges to go along with their medical ones.
That's really impressive. With all of that, I know it's probably hard to choose as well. What has been one of your most successful days on the unit?
I think our best days are when you can see everyone pulling together, much like Gladys describes. There's a real sense of teamwork here, and I find that there really is no service here that doesn't put our patients first. We have consistency in employment with our caseworkers, our physical therapists, dietary. Anyone that touches our patients is someone who knows how to work with the other service. And we come together frequently to get the work done that's needed because it's such a dynamic environment. So I think that all days have an aspect of success, but when I'm directly working with the staff and with the patients, those are the things that make me feel most successful as a nurse, and I get the most reward from.
That's great to hear. When I joined 𝗟𝗡𝗀 2 years ago, I had never been to any of the Lafayette facilities, and I remember touring university, and I definitely felt that. It's great. Now, what can a new graduate expect during orientation there?
Our new graduate RNs go into a residency program that was initiated at our main campus and started with us this year. That continues for a full year with monthly seminars, workshops, and peer mentoring. And I think that will really deepen what those new nurses get as they enter practice. On the unit itself, there's a 3-month orientation. Just as Gladys describes, we can go longer if that's what someone needs. And often that 12 weeks covers just the basics. If someone's going to work nights, then we start them on days, generally speaking, so they can get comfortable with the facility, the processes, and the resources that are available to support them. So I think that's strong. And then we also have 24-hour house supervision, and all of those house supervisors, again, have tenure, and a critical care background, either with emergency room or the intensive care units. So I feel like that makes a good introduction for new nurses, and the size of our facility enables us to be very close to them during that onboarding process.
Absolutely. Thank you so much for sharing all about your experience at Lafayette University. And we're going to have 𝗟𝗡𝘄 kind of take us home from the nursing perspective. So 𝗟𝗡𝘄, you are at 𝗟𝗡𝘀 New Orleans. Can you provide us with an overview of your unit and why you think it's a great place to get started with your nursing career?
Yes, so as Caitlin mentioned, I am the director of the emergency department in New Orleans. We see around 70,000 patients per year. We are also an academic center, much like Rachel mentioned they are. One good thing that I think that a good reason to start your career here with us is we see an array of patients. The acuity is very high. We have a pediatric ED and an adult ED that's kind of combined, so you can get experience on both sides of that. We see all types of patients that come in. We're a stroke comprehensive center. We're an LVAD center. We have transplant. We have oncology. So there's lots of different things that you can come and learn what your specialty is. And we see super sick patients every day. We're a 37-bed unit that includes the adult side and the ped side. I overall just think it's a great place to start your career because most nurses go into the career not really knowing what they want to do. And you kind of see all aspects from this side, whether it's fast-paced, slow-paced, intake kind of work, all different angles of what patients walk in the front door with.
Definitely. And like you mentioned, you kind of see it all. So I'm sure it's hard to choose, what would be your most successful day on the unit. But can you think of anything?
So I would say I agree with you. It's hard. I think every day is a successful day in the emergency department. Any day that we can save a life, we're with patients at the hardest times with their families when something's going on that they're scared and they don't know what's going on. If I had to pinpoint a specific day, I would think that it was throughout COVID. We were faced with something we had never been challenged before, and we were able to actually quickly open up an REU called a respiratory unit pretty quickly. And I think we were provided with the resources to do that. And with our emergency department background, we're able to quickly adapt and figure it out because we never know what's really going to walk through the door.
I love that. Yeah, I think that kind of sums it all up. Now, how can you describe orientation for a new grad on your unit over at 𝗟𝗡𝘀 New Orleans?
So we do have a pretty intense 12-week orientation. It can sometimes be shortened depending on the person. It can sometimes be extended, not necessarily a bad thing. We just want to make sure the right person has the right amount of time in orientation. We have you partnered with somebody in the department, and then we sometimes even will rotate you throughout the shift so that you can also be experienced throughout all different of the shifts throughout the ER, because we do have fluctuating shifts within the department. We have weekly check-ins with you and your preceptor, whoever you're assigned to, with our educator, to keep those touch points to make sure you have what you need to be successful. And we've also recently, in the last 6 months, created a new grad sim lab day, where we actually take you over to our sim lab across the street, and we have 3 different simulations where we give different patient scenarios to the new grads so that they can kind of work their skills and make sure they're kind of where they need to be. And then we also, throughout that sim lab day, we actually tie in the patient experience and why it's important for us to do certain things with our patients and make sure they feel comfortable and they see our compassion that every Ochsner nurse needs to have.
Thank you so much for sharing, 𝗟𝗡𝘄. I really appreciate it. All of our panelists have shared their love of Ochsner and, specifically where they work. And I think have inspired us all to find a way to join the team. So Katie, if a new graduate is interested in applying, can you share with us what the application and interview process is like? What can they expect with the timeline? Just kind of give us an overview of what to expect.
Absolutely. Thank you so much, Caitlin. So yes, when you have decided that you want to be part of our Ochsner family, we will direct you to ochsner.org/careers. And you'll look for our RN or LPN new grad job posting. If you have signed up for this, that will be emailed directly to you, that direct link, but you can search the keyword new grad and it will pop up. We have a team of recruiters dedicated specifically to new grads, and we're very proud of that, to allow more concierge service to our new grads and find you the right home. So we will phone screen you for approximately 15 to 30 minutes to make sure that you're a good fit for our organization. Do you embody our guiding principles and with compassion, like Chelsea said, and patience first and that type of thing. From there, we'll figure out where your passions lie. And we have the ability to set up shadow shifts with these wonderful leaders that we have on the call, as well as many others across the organization. And then after those shadow shifts are complete, we will follow up with you. We are very fortunate to be able to extend job offers approximately 6 months, sometimes even a year in advance, because our highly requested units fill up so fast. I can't even tell you how quickly they fill up. We're very proud of that. People are proud to work at Ochsner, but we're here to help you, guide you, and make sure that you have found the right spot and the right home with Ochsner.
Thank you so much, Katie. This has just been a great conversation, very enlightening and informative. It's been great to get insights from this group. I want to thank all of our panelists for this conversation and for sharing your love of Ochsner and where you work. I think it really, shows through your words and stories. I wanted to take this time to see if anyone has any questions for our panelists. Feel free to put them in the chat, or if you want to ask them aloud. So this is your time if you have any specific questions. Okay, well, looks like we don't have any questions right now, but if you think of a question or, something pops up, you can reach out to Katie specifically on the student talent team. You can email them at studenttalent@ochsner.org. And then, like Katie mentioned, if you want to learn more about what it is that you're interested in learning about Ochsner through our career site, the requisitions to apply if you're a new grad, that is at www.ochsner.org/careers. And again, email the student talent team. But again, thank you so much for everyone for joining this call, all of our participants and attendees, and as well as our panelists for joining and taking the time out of your very busy schedules, because I know you are all so busy. And this has just been a great learning experience. So thank you all for joining us today, and I hope you have a great evening.